supposed to be here. Yeah, why don't you guys come like a little centered and...
Do you have the order?
And yeah, I do. It's right here.
Oh, thank you. Okay.
All right. Good morning or good afternoon. I am Congressman Dr. Raul Ruiz. I'm an emergency medicine physician, practice in emergency departments, and I also specialize in public health and humanitarian disaster aid. It's an honor serving California's 25th Congressional District, and I want to thank Climate Power for bringing us all together today in the rain. We are here because the health and safety of the American people are under attack by the Trump administration's dangerous attempt to roll back the EPA's endangerment finding. This critical determination, rooted in science and law, established that greenhouse gases endanger the public's health and welfare. We knew that. To roll it back is to deny science, undermine medicine, and threaten the health of our communities. As a doctor, I've seen the human cost of air pollution. Greenhouse gases are driving hotter temperatures, which make heat waves deadlier, increase with the dry environment, increase more fires. The smoke from the fires are intensifying. They intensify extreme weather, putting families at risk. And as the days get hotter, smog gets worse, triggering asthma, heart disease, and lung disease. And I saw this up close during my years as an emergency physician in the Coachella Valley. Families in Indio, Thermo, Mecca, North Shore face emergency room visits for asthma that are 60 to 80% higher than the state average. In fact, children in the Imperial Valley, inside the Imperial County, have the highest rate of asthma hospitalization in the whole state of California. And on some days, residents are forced to breathe pollution levels 2 to 3 times above what's considered safe. And studies have shown that the people who live in high air polluted areas like near congestion and traffic die 10 years earlier than people who don't live in high air polluted areas. So if the endangerment finding is rolled back, the EPA will lose its ability to regulate greenhouse gas pollution under the Clean Air Act. And that would erase decades of progress, worsen air quality, and leave vulnerable people defenseless. Vulnerable people like seniors and children. As physicians, we are taught a simple rule. First, do no harm. And this rollback would do enormous harm. It would increase pollution, worsen health outcomes, and cost lives. So instead of turning back the clock, we need to move forward. That means investing in clean energy, building resilient infrastructure, and protecting workers in their workplace and the communities on the front line of pollution and climate change. And we must base our policies on science, not ideology. The health of our children, our seniors, our workers, and future generations depends on it. So I urge my colleagues to reject this reckless rollback, to stand with science, doctors, nurses, all the people here, Climate Power, and to stand with the public for the public's health. And I want to thank you. Now I want to introduce Representative Kelly Morrison, the OBGYN specialist and a great representative.
Thank you, Dr. Ruiz. Good afternoon. It is so good to be here with all of you, and thanks to Climate Power for bringing us together to highlight this incredibly important issue. I'm Kelly Morrison. I represent Minnesota's 3rd District in Congress, and I had the privilege of caring for patients as an OBGYN for more than 20 years. We're here today because climate change is not a hoax. Climate change is getting worse, and this administration is undermining all the progress we were just beginning to make. This administration is enacting policies that increase emissions at a time when we need to urgently decrease them. And right now, they're working to take away one of our greatest tools to protect against air pollution and fight climate change by repealing the endangerment finding. This would be a disaster for our nation. The reality is that climate change is making our communities less safe and less healthy. And we should be doing everything we can to address this threat to public health. Just this summer in my home state of Minnesota, people couldn't even be outside because the wildfire smoke was so bad. You couldn't breathe the air. We experienced among the worst air quality in the entire world and broke records for the state's longest ever air quality alert from wildfires. And that's what happens with climate change. Climate change fueled by climate pollution leads to more extreme weather and disasters like wildfires, which put our health at risk. Climate pollution isn't just an environmental issue. It's a public health emergency. And protections against pollution aren't just for the environment. They are essential for our health. For an administration that is allegedly interested in making America healthy again, you know what won't make us healthy? Taking away our right to breathe clean air, letting fossil fuel companies dump more toxic pollution into our air that accelerate climate disasters, fuel deadly heat waves, and worsen chronic disease. Increasing climate pollution, which we know will lead to more asthma attacks, more ER visits, more heat strokes, more deaths. And I just want to point out two insidious themes of the Trump administration in this proposal to repeal the endangerment finding. First, this is the Trump administration pushing out more completely unqualified, unbacked, non-evidence-based junk pseudoscience, defying everything we know from science and experts, putting out misleading reports that disregard decades of scientific evidence. They aren't just ignoring the scientists and the physicians and the nurses anymore. They're now completely rewriting the facts to support their agenda. We have a government that is trying to distort reality and tell us lies. This is dangerous. Second, this is the Trump administration's playbook of prioritizing billionaires and huge corporations at the expense of you and your family. They are selling off the health and well-being of the American people to the highest bidder. In this case, it's big oil. It's exactly what they did earlier this summer with the cruelly named One Big Beautiful Bill. They looted Medicaid and made the single largest cut to health care in our nation's history to pay for tax cuts for billionaires and huge corporations. And now they're at it again. They're paving the way for giant corporations to dump toxins into our environment with zero regulation, zero oversight, and zero accountability. And who pays the price? All of us. We are facing one of the Trump administration's most consequential steps so far to take away our ability to act on climate change and protect public health. I encourage everyone to speak out and get loud about this. This is about our health. This is about our right to breathe clean air. And know that health experts and scientists stand with you. And with that, I'm going to turn it over to Dr. Lisa Patel, Executive Director for the Medical Society Consortium on Climate and Health.
Thank you so much, Representative Morrison. My name is Dr. Lisa Patel. I'm a pediatric hospitalist and the Executive Director for the Medical Society Consortium on Climate and Health, which represents over 700,000 physicians around the country. Every day, I care for children whose health is being harmed by the realities of climate change and air pollution. I witness firsthand how these environmental threats leave lasting imprints on their developing bodies and futures. That is why close to 100 organizations, including major national societies such as the American Academy of Pediatrics and the American College of Physicians, have joined our sign-on letter asking the EPA to protect and strengthen the endangerment finding. Our medical community, including doctors, nurses, and pharmacists, is united in affirming that climate change is a clear and present danger to the health of communities today and stands to grow worse without concerted action. Over Labor Day weekend, I worked 48 hours in the hospital with a heat advisory in effect. Our labor board filled up with mothers in preterm labor and other medical complications. Our NICU had to makeshift extra spots to accommodate more infants. Extreme heat events, which are more frequent and more severe due to climate change, are a risk factor for poor birth outcomes, and this threat grows worse every single year. A child born today can expect to experience twice as many wildfires, 3 times as many flooding events, and 36 times as many heat waves compared to someone born in 1960. Children's developing lungs, brain, and immune systems makes them more susceptible to the harm from climate impacts. These environmental stressors can trigger respiratory conditions like asthma, heat illness, chronic disease, neurodevelopmental disorders, and more. We are also seeing increased rates of anxiety, depression, and trauma-related disorders in children exposed to extreme weather events. These exposures translate into higher healthcare costs, poorer educational outcomes, and reduced lifetime earnings for affected children. Yesterday, Secretary Kennedy released the Make America Healthy Again report, outlining threats such as poor nutrition, air pollution, and sedentary lifestyles to children's health, promising the administration would tackle these head-on. Rolling back the endangerment finding would worsen air pollution we found evidence of in children's brains that appear as early signs of Alzheimer's disease. Allowing climate change to worsen means more extreme heat and wildfires, events that are already keeping more children indoors and away from the physical activities we know they need. And farmers, central to Maha's promise, will face declining nutritional value in their food crops from a warming planet. The EPA's proposal contradicts the overwhelming scientific consensus on climate change, disregards the near-daily health impacts Americans are already experiencing, and places our nation on a dangerous path towards greater illness, suffering, environmental, and economic harm. Our message is clear: protect our health, protect our children, protect the endangerment finding. I will now turn it over to Dr. Cook, who is the Deputy Director for the Alliance of Nurses for Healthy Environment.
Hi, good afternoon. Thank you all for being here today. My name is Cara Cook, and I'm a registered nurse and Deputy Director with the Alliance of Nurses for Healthy Environments, a national nursing organization dedicated to advancing human health and the environment. Nurses are on the front lines of protecting health. We care for those most impacted by pollution in ERs, in oncology departments, in cardiology clinics, in urgent cares, and at schools. Nurses see the human toll of climate change every day. More asthma attacks, more ER visits, more people struggling to breathe. The climate crisis is a public health emergency. It demands bold and ambitious action. It demands action grounded in sound science. There is an overwhelming scientific consensus that emissions from human activities are accelerating climate change. The Trump administration's efforts to repeal the EPA's endangerment finding is not only dangerous, it is an attack on science and on the health of the American people. The Department of Energy's report, which EPA is using to justify this repeal, is deeply flawed. It misrepresents scientific consensus and significantly downplays the serious risk human-caused climate change poses to public health. Using this report to guide official EPA action and regulatory policy is not just irresponsible, it is unacceptable. Climate change is here, it is harming our health now. Rescinding the endangerment finding and denying the link between pollution and climate change is a giveaway to polluters, paving the way for more fossil fuel emissions, more toxic pollution, and more human suffering from deadly heat waves, worsening chronic health conditions, and extreme weather disasters. The health of our communities is on the line, and we cannot afford to move backwards. Nurses across the country are calling on EPA to uphold its mission of protecting human health and the environment. That means keeping the endangerment finding intact, defending science, and taking urgent action on climate change. Nurses will continue to push back against the Trump administration's reckless actions to undermine science and jeopardize public health. We will continue to fight for our kids, our patients, and future generations. Thank you. And with that, I'm proud to introduce Dr. Alice Chen, Board Chair with Healthcare Without Harm.
All right. Hi, everyone. I'm Dr. Alice Chen. I'm a primary care doctor and a mom. I'm also the board chair of Healthcare Without Harm, which is an organization that works with 1,700 hospitals in the U.S. and organizations representing over 70,000 hospitals in 86 countries that are working to reduce their greenhouse gas emissions and protect patients from the health impacts of climate change. The proposed EPA rule ignores the realities of the way climate change is already harming people's health across America. My clinic is just a few miles from here. My patients are largely working class. They care for our children, they clean our offices, construct our homes, cook our meals. Many have elderly patients, young children, are pregnant, have diabetes or asthma, and they're at higher risk of health problems from air pollution and climate change. They don't have the resources of the ultra-wealthy who are building climate change bunkers as if they don't rely on other people and a healthy planet. Air pollution from burning fossil fuels increases the risk of heart attacks, strokes, lung cancer, and premature death. It's also causing the climate changes that we are all feeling in our lives, with worsening heat waves, wildfires, floods, and storms. A doctor in Houston, Texas, told me that the ER where he was working overflowed with patients when Hurricane Beryl knocked out power for home oxygen concentrators, home dialysis machines, and medications that required refrigeration. A classmate from medical school was there when Hurricane Sandy flooded the basement of his New York hospital, causing the backup generator to fail. He ferried fragile NICU babies down the stairwell to ambulances that raced to other hospitals. A former patient texted me frantically when fires raged across Los Angeles earlier this year. I advised her to go to a Red Cross shelter, but the crowded, stressful conditions made her chronic anxiety and PTSD flare. My family was lucky enough to change to an EV earlier this year, and my son, who's 9, was in a gas-powered car that was idling the other day. And he said to me, "Mom, what is that awful smell?" It was exhaust. Even a 4th grader knows what the science has made clear. Air pollution and climate change are bad for our health. Climate change is not just a political talking point for doctors and nurses and our patients. It's a growing threat to our health and the ability of our hospitals and clinics to stay open. In fact, the number of executive leaders at Healthcare Without Harm's partner hospitals who recognize climate change as a risk to their operations has grown from 14% in 2020 to 46% in 2024. It is no wonder that hospitals around the country are setting goals to get to net zero greenhouse gas emissions, to build climate resilience, and to protect patients using science to guide them the same way they use science every day to save lives. The EPA must stand with doctors, nurses, hospitals, and our kids. Stop this dangerous proposed rule and return to the critical work of regulating greenhouse gas emissions for the health of our nation. Thank you.
Thank you. That concludes our press conference. I want to thank all the staff that are dedicated to be here in the rain and all the people that are standing here. It's, as you can see, it's raining, and they're so dedicated because this issue is real. It's cost human lives, and we're going to fight tooth and nail to make sure that we protect our environment so that we can protect people and their health. Thank you so much.